Great. Hello, everybody. It's great to be here. Thank you for sticking around for our last panel about hospitals. We're going to have kind of the same themes around procurement and plant-forward diets, but you'll see some of the kind of differences with hospital food. And we have Betsy there on the Zoom. Betsy, thanks for joining us. I'm going to set the stage for just a moment, and then I'm going to have each of my panelists spend just a couple minutes introducing themselves and talking about what they do and how it impacts greenhouse gas emissions in food. To set the stage, so what is unique about hospitals? I think one of the biggest things is that in hospitals you are co-mingling patient diets with everything else. So patient diets with cafeteria, patient diets with retail, and it's all under one roof. So in the back of the house is all your food procurement is together, your preparations together, your labor is together, your financials are together. So it's very hard to kind of tease it out. But you have to do these two separate types of food service all together. We also have patient diets that are heavily regulated at the state and federal level. In addition to that, we have physicians' diet orders. They're issued during a hospitalization. They're highly specific and prescriptive, and they're tailored to each patient's medical condition. Sometimes there could be upwards of 70 to 100 different types of diets that could be ordered for the patient population. Hospitals have large workforces that they insure, so they have an invested interest in ensuring the health of their staff. And we also have hospitals are a healing environment. This was mentioned previously, that hospitals need to make sure their food offerings reflect and reinforce the mission and brand identity of the organization. And there's a big perception that hospital foods should be cheap. I don't know where this started, but it's always been there. But it's supposed to be cheap for everybody. And surprisingly, nearly every single food service operation in a hospital is subsidized and sometimes heavily subsidized. So there is a lot of expenses and costs and things to consider. And my panelists of experts have to navigate these things every single day. And I'm going to start with you, Betsy, for introductions since you are joining us on the Zoom. Betsy's with Healthcare Without Harm, and Healthcare Without Harm is transforming healthcare worldwide to reduce environmental impact. And Betsy, you could take a few minutes just to introduce yourself and tell us what you're doing.
Sure, great. Hello, thank you for having me join you today virtually. So my name is Betsy Skoda. I'm the Associate Director of Supply Chain Transformation with Healthcare Without Harm, and I specifically work on our food supply chain transformation. As Helen said, Healthcare Without Harm seeks to transform healthcare worldwide to reduce its environmental impact and become a community anchor for sustainability. And so we work with hospitals and health systems to understand the environmental and climate impacts of their operations. And through research and pilot projects, we work with them to identify new and promising practices to limit their adverse impacts. We also encourage hospitals to work and engage closely with their local communities as part of an effort to build a strong foundation for climate resilience. Healthcare Without Harm has a membership organization arm, which provides members with tailored support, opportunities for peer-to-peer networking and access to a wide range of learning experiences, in that those experiences are based on the research and learnings from our pilot projects. And with our food procurement work, we're really trying to guide healthcare institutions to adapt their procurement practices to support a sustainable food system. So we engage with them to examine what they buy and serve and what factors influence their decision-making and implement changes that align with their goals. And our aim is really to ensure that healthcare practices contribute to the development of a just and healthy and sustainable food system.
Thank you, Betsy. Sitting to my right is Soledad Hearon. She is the Sustainability Director for Sodexo. Sodexo is a global food service and facility solutions, facility and life solutions contract management company. Soledad is in the healthcare division.
Yep, so my name is Soledad Hearon, and I lead sustainability for healthcare and seniors in the US. Want to thank everybody for including me as part of this panel. I'm so grateful to Stanford University to include us here. It's Sodexo by nature is a sustainable company. We feed over 100 million people a day. So we need to have some sort of social, economic responsibility to the communities we serve. Sustainability is one of 2 pillars in our strategy that is listed in our financial registration statement. That means that we are legally and financially bound to our commitments. Our commitments now for Better Tomorrow 2028 is surrounded around people, partnerships, and the planet. And a big part of what we try to do is all based in our commitments. And without those commitments to be really focused in how we embed sustainability in our programs. With healthcare being what it is, feeding vulnerable populations, we talked a little bit about scope 3, and I guess we'll go into that in a little bit. But we really need to be conscious about our supply chain being safe, right? Consistent, and being able to feed these folks over a period of time that will coincide with cost measures. Because like Helen said, for some reason, the industry believes that food for patients needs to be cheap. And I hate that word, right? Our food should never be cheap. So just some thoughts out there about that.
Thank you. Next up, we have Katie Cantrell. Katie is the CEO of an organization called Greener by Default. They apply behavioral science to nudge diners towards more sustainable, plant-rich foods. Katie.
Yes, so thrilled to be here today. I can tell you a bit about my background as the reason for doing this work. So I studied psychology at UC Berkeley, apologies, at Stanford. And I spent a decade running an organization that did education about the harms of the factory farming system. So we gave very depressing presentations that really no one wanted to hear. It's, better not to know. And having studied psychology, I came to realize that facts, unfortunately, don't change people's minds. And as we talked about, as several of the panelists talked about earlier, labeling something as healthy actually deters people from taking it. And so really one of the most effective things we can do is just to make the better choice, the healthy, the sustainable choice, the easy choice. And so that's what motivated me to start doing this work. And Greener by Default's focus is, as Helen mentioned, applying behavioral science to institutional food policy to make the plant-forward options the easy choice, the appealing choice, and to really encourage flexitarianism. So rather than often the way things are presented right now, it's sort of this binary that acts as this identity trigger, where if you identify as vegetarian or vegan, you're gonna go out of your way to request that plant-based option, but otherwise you're taking the normal choice, which is meat and dairy, and the standard American diet, which is neither healthy or sustainable. And so we're working with institutions to help reframe the way that options are offered to normalize these healthy and sustainable choices.
Thank you. And last up, we have Andrew Shakman. Andrew is the CEO of Leanpath, the premier technology solution provider for food waste solutions.
Thanks. So first of all, I'm a Stanford alum, so it's nice to be back. It's been a little while since I've been here. And at Leanpath, we are focused on fighting food waste. And we take the view that food waste is one of the most critical issues we can work on if we want to solve a number of problems, whether it's focusing on climate, or it's focusing on food insecurity, or it's focusing on economic loss. It has shockwaves that go out and impact land conversion and biodiversity and resource availability and things we'll talk about today. So we're very passionate about that. We've spent the last 22 years at Leanpath working on making food waste prevention everyday practice in the world's kitchens. And we were able to get our start in doing that work in acute care healthcare. And so it's really where we learned about food waste. And I'm happy to have Tony Belzarini here, who was one of my very, very first willing partners in experimenting with this crazy idea. He was, I think, one of our first 5 customers. And off we went on this journey learning about food waste and healthcare and how we could fight it. And what we found is it's a very solvable problem, and I look forward to talking today more about that.
Thank you, Andrew. All right, first section up, we're going to talk a little bit about procurement and operations. And Soledad, I'd like for you to start. Last year, Sodexo launched a plant-forward patient menu on a national level. No easy feat. That's a lot of different accounts. What outcomes or insights have emerged from this initiative?
Okay, so very complex question, or simple question with a complex answer, right? So intention is great, but the reality of the outcome really depends on that perception. And we've spoken a little bit about that throughout the day here and on this stage now, that notion of using that word plant-based, believe it or not, it's a hard sell, right? Because at K through 12, at the university level, it's a little bit of an easier sell than your average 72-year-old who's not feeling well in a hospital, right? So I would say that first and foremost, what's most important is partnerships. We've had a partnership with Helen, we have a partnership with Greener by Default, we have a partnership with Leanpath, we have a partnership with Practice Green Health. So partnerships are key. And not just industry partnerships, partnerships with our suppliers, partnerships as Moira, who is on the stage, I really related. And then we have Stephen Rendez over at Stanford Health that does a phenomenal job, right, as part of his team. So supply is key. And I will say, right, not just because of carbon emissions, but when we're talking about delicious food and presenting delicious food, we can talk a little bit about our partnership with Practice Green Health, Greener by Default, right, who helped us with scripting and menu labeling and all of these things. And similar to what was said before, right, as soon as that icon is on that menu, nobody wants it, right? And your average 72-year-old who's not feeling very well wants, guess what? Meat and potatoes, right? So how do we sell on deliciousness? How do we focus on menus that are focused on low carbon procurement? And how do we bring that satisfaction to that patient? So we've had some learnings along the way. I will say that we have now gotten our menus together and in a way that really works throughout the value chain, right? We have culinary at the national level who's really working on cultural recipes focused on ingredients that sound delicious, that are delicious, that are fairly inexpensive for our teams to put together, that fit the criteria of what institutional food needs to be, focused on pulses, legumes, wonderful vegetables, right? But is also tied into that supply side and adherence to those menus so the supply side can have an easier way through that data is key. So all of this kind of comes together to make this beautiful mix of an opportunity to provide a patient something that's warm, comforting, going to make them feel better and make them want to eat, right? So when the chef special comes up, they know it's something that's going to be satisfying, delicious, and makes them feel better.
Soledad, you mentioned partnerships.
Yes.
Key, very, very key.
Very key.
And Sodexo and Greener by Default had a big partnership. I think it was maybe 2 years ago when it first rolled out. But Katie, I really would like for you to share that with the audience. It was highly visible. New York City Health and Hospitals initiative. Please tell us about that and some of the results that you achieved on that.
Yes, so that was our first big pilot. And what Greener by Default has done has taken these behavioral nudge strategies that really come from academia and apply them to the real world. And now we're constantly iterating and taking these learnings and figuring out how to scale them, which we're so grateful for our partnership with Sodexo. So New York City Health and Hospitals, they have what's called bedside ordering. So a food service associate goes to the patient's bed and first offers them these 2 different chef specials of the day. And then if the patient doesn't want either of those, there's a static menu of options available. So prior to our pilot together, they did do meatless Mondays. So on Mondays, they were vegetarian, but every other day of the week, both of the chef specials had meat. And if patients were vegetarian, they could request a vegetarian option. So initially for the pilot, during lunchtime, both of the chef specials were plant-based. And if the patient didn't want either of those, they had other meat options to choose from. And it was tremendously successful. Over half of all eligible patients were choosing one of those plant-based chef specials. They were very happy with their options. And so because of this, it was then expanded to all meals across all 11 public hospitals in New York City. It's the nation's largest public hospital system. And it's been in place now for several years. And what they found is still over half of all eligible patients are choosing these plant-based chef specials. They're saving about 60 cents per tray, so over $500,000 per year. And they've cut the carbon footprint of their entire food service program by 1/3. And patients are still extremely happy with the food. So as Jackie was saying earlier, like it's really a win-win across the board. And so it's great because we've been able to showcase this as an example of that hospitals actually around the world have sent teams to tour the facilities in New York to learn about what they've done. And as Soledad mentioned with the culinary piece, that the culinary director there did such a fantastic job making sure that the dishes were culturally appropriate to the patient. So as you were saying, it's something that's familiar. It's not some sort of scary new food. It's something that's really hearty and delicious and familiar. And also making sure that the food service associates and the nurses and the face of dining and the people that patients are interacting with got to taste the food. They did these culinary road shows so that they could all see firsthand, this is really delicious, and genuinely recommend it to patients if they're saying, oh, I don't know, is that actually good? So, all of these pieces came together, and we've really been so excited to tell this story and inspire other healthcare systems to get on board and to partner with Sodexo to expand the plant-based defaults for 1 meal a day across most of the hospitals in Sodexo's portfolio.
Awesome. Great results there. Andrew, so food waste, Andrew is our only expert, I think the whole day, who's talking about food waste, and it also relates to Scope 3. It relates a lot to cost savings, and of course the more imperative, not throwing food away. Lots of things going on there, but it sometimes doesn't get the attention I think that it deserves. So let's see, so it's not just a hospital concern, it's in universities, it's K through 12, it's in our own homes. And so if you could provide a little background on why it's such a critical lever for cutting greenhouse gas emissions, not only locally, but nationally and globally.
Sure. So we know that somewhere between 8 and 10% of total greenhouse gas emissions are related to some part of the process of growing, harvesting, transporting, refrigerating, cooking, and disposing of food that's wasted, right? So that is if you think about the overall footprint of the agri-food system being maybe 31%, and we're wasting roughly 1/3 of the food that we produce, we have a huge climate impact that is linked to wasted food. And when you start looking at the math, there really is no conceivable path to staying within 1.5 to 2 degrees in the Paris framework without significant impact on food systems transformation and more specifically food waste change. And so this is a very important part of the overall climate conversation, but it's also important in terms of feeding people. And we know that we have massive food insecurity around the world. So there's definitely an urgency to address it from those perspectives. There's also $1 trillion that we're putting into the garbage every year, setting that aside. So yes, it's a major concern, and as I mentioned earlier, it's something that we really do have the ability to solve because it's very much related typically in the developed world to choices that we make that are behavioral more than anything else. So we make choices about what we buy, how much we buy, whether we use it or don't use it, and so it's the sort of thing that when we start actually paying attention to it, we can make a big dent.
And can you share with us when you go into a new operation, maybe that hasn't done, and the audience may not know what your tool, maybe a little description about what it does. It's not analog sheets, it's cameras and AI. What type of results do you see when you're going in? Like, what's the potential there?
So the core premise that we have at Leanpath is that if you begin measuring your wasted food, you will begin changing. And we know the things that we measure are the things we manage, the things we measure are the things we improve, and yet historically there was not measurement of wasted food. When we started a long time ago, it was out of sight, out of mind. It was the elephant in the kitchen. It was just there and accepted and tolerated, and it was the way we do business. So we said, let's start measuring it as the core intervention. Let's get data about this, and if we can understand what we're wasting and why we're wasting it, we can start to have change. So the way we do that is we provide technology tools to make measurement possible. And yes, AI cameras and scales and some amount of information from folks working in the kitchens, and then putting that all into an analytics platform where we can see it, and then even more critically, action it. So start to move from just getting data to getting action associated with that data. And so collectively, that's what we think of as an enterprise food waste management platform. So that's what we build. And the theory of change is really in two areas. One is that by measuring, we will have an impact on behavior. Just the act of measuring, if we did nothing with the data, the moment we start asking people to stop and take a moment to measure something, it communicates a signal that food waste is important and matters. And so I did my degree in theater about 100 yards that direction, and I think of this as theater in the kitchen, and very much about sort of getting people to think. And then there's the other side of the equation, which is the analytical side, which is how do we produce less, how do we purchase less, how do we change our menus to optimize around not having waste. So that's the core intervention.
Thank you. We'll come back to that in a bit, because I know you're partnered with Sodexo on that as well, and have been for years. I do want to switch over to Betsy. And Betsy, thanks for joining us. Are you in New York? Is that where you're joining us?
I'm in Rhode Island, in Providence.
Rhode Island. So it must be getting late there. So we'll get you out of here quick. Based on the work that you do, I'd love for you to give the audience an overview of what is values-based procurement.
Yeah, so values-based procurement is an approach that uses purchasing dollars to achieve multiple benefits. And so it's considering a variety of factors, such as how food is grown and by whom, how workers are treated, and what are the health and environmental impacts along the food chain, from production to consumption to disposal. And Healthcare Without Harm has the Healthy Food and Healthcare Standard, which aims to serve as a roadmap for hospitals to advance values-based procurement. And so the standard is actually based on work that we did in partnership with the Center for Good Food Purchasing and Real Food Generation, where our organizations, representing healthcare, K through 12, and the higher ed sectors came together to look at the standards that we were using for our sectors and align criteria and definitions and strategies. And the aim is really to be able to better understand the impact of purchasing and also send signals to the supply chain about product priorities that align with values-based procurement. And the values that are at the foundation of this aligned standard are local economies, community health and nutrition, environmental sustainability, animal welfare, and valued workforce.
Thank you for that. And the theme that keeps coming up is that triple P, people, planet, profit. So a lot of the interventions, or almost all of them, hit all three of those, which is the home run, particularly if you're trying to advocate or get leadership to buy into a program. You have to bring in that ROI. And of course, you have to lead with the money. Generally is what I find. You have to do that. But Betsy, you also, how do you leverage, how does Healthcare Without Harm leverage the power of procurement to reduce the food greenhouse gas emissions? You guys have a lot of data. You do Practice Green Health does annual surveys. They collect a lot of data. So how are you using that data?
So we use the data in multiple ways. I will say that our procurement is part of a kind of a suite of strategies that we used to reduce greenhouse gas emissions related to food. So within this framework that I mentioned, there are very specific targets around environmental sustainable purchasing. And the strategies that are, related to that are reducing animal products, of course, as well as, looking at the mix of products that you're buying, so that you're achieving, I think the aim is 50% of essentially plant-based products in your purchasing, as well as, engaging in activities that aim to promote climate-friendly diets to consumers to increase their demand. But along with the procurement work that we're doing, we have the Cool Food Pledge. So we are the technical assistance provider for hospitals that sign on to the Cool Food Pledge, where they're committing to reduce their greenhouse gas emissions by 25% by 2030. And as part of that, we're collecting, through that awards process, we collect the data, we analyze it, and then we can turn around and talk with the hospitals to understand kind of what the pain points are in making progress. And procurement, of course, can be a challenge trying to identify and secure the right products, to align with all the varying needs of the eaters that they're serving. And then additionally, to complement this work on measuring the greenhouse gas emissions and procurement, we are also involved in some food waste work. So Healthcare Without Harm is a signatory to the U.S. Food Waste Pact, and there's a coming opportunity for hospitals to also sign on, and we'll be engaging with ReFed to support them in measuring their food waste reductions. And together, we're collecting all of that data so that we can provide our hospital partners with a picture of where the greenhouse gas emissions are in their food service, and then connect them with resources and engage them in various activities that aim to help them reduce those emissions.
Thank you for that. And I want to just say, having worked with your organization as an operator and as a consultant, there are a lot of resources that are available. And I'm pointing to our Stanford table over here. They've been involved with Healthcare Without Harm for years. They've won the annual recipe contest a couple years in a row. I think one of your accounts won it last year. You guys joined last year. So back to that partnership. But Healthcare Without Harm, if you're in hospitals, I encourage you to check it out because there are resources and there's different modalities, like Betsy's talking beyond procurement. You do food waste and health equity and values-based procurement are just a few of the tools. There's many more in there as well. So because I know we have a lot of dietitians in the room, and I'm a dietitian myself, and you're a dietitian too, aren't you? Yep. So the question for you, and Sodexo is a really main employer of dietitians in the United States and globally. What role do clinical dietitians play in promoting sustainable diets?
Such a key, important role besides helping to formulate some of these menus that we need for patients, right? And really organizing a lot of the community outreach with some of our recoverable food. They are instrumental in making sure that their intervention, which is food to support healing, is a key component. So I'll give you an example, and it's going to kind of bring everything together a little bit. We have a site in northern New Jersey, very little site, about 130 beds. They average feeding about 90 to 100 in their census, and they have Waste Watch powered by Leanpath at their site, and engagement is key. And the chef and the clinical nutrition manager and the site manager are highly, highly engaged with this process. The frontline team members love it because anybody who has had some sort of experience with food insecurity wants to do whatever they can to help minimize that waste or make sure that they can recover whatever they can. Most of the food waste in our organization currently focuses on pre-consumer, but this site like some other sites in our organization, has done such a great job. They now do post-consumer. And they started to notice, right, post-consumer food waste from a patient perspective is low-hanging fruit, right? It comes into the dish room. You're able to see how much of those chef specials, those go into one bin, another one goes, all the oranges go into another bin, the jellos, the supplements go into another bin, and it gets weighed. Well, this one site noticed that all these oranges were going and coming back. So the clinical nutrition manager worked very closely with the chef because, again, food is their intervention, right? Trying to figure out why all of these oranges. So first going to the order takers, are we just giving patients oranges and they're not asking? No. So they looked at the data, they noticed that over 70% of the patients were actually asking for these oranges, so why aren't they eating the oranges, right? What's the problem? Then we send the patient experience people up. The patient experience are doing the root cause and asking patients, I noticed you didn't have your orange, why don't you want your orange? Okay. From that, they were able to find out that the oranges were just too big that they were purchasing. And the type of orange that they were for most of the population were very difficult to peel. So in the partnership run by the clinical nutrition manager and our culinarian and our site managers, they were able to work with procurement, with their regional house, and be able to find an orange that was similar nutritional value and easier to peel. They noticed a 52% increase in the uptake of those oranges. So if it wasn't for a clinical nutrition manager really involved and engaged in the process and making sure that those patients were getting what they were supposed to be getting, we wouldn't have had that wonderful improvement.
Thank you for that, and that's about procurement. And also, Katie, we were speaking earlier, and I believe that Jackie might have referenced it as well. You're involved in a project to help with this whole gnarly thing about procurement data and how you tease it and figure it out and be able to get data that you need to report and understand if you're actually making progress or not. So would love to hear more about that project and where it's going.
Yes, so as I'm sure many in this room have experienced, procurement is really one of the most difficult, if not the most difficult parts of doing this work, and it's so necessary to tell this story and really see the impact. So at Greener by Default, usually we start with a pilot because these are big changes and we understand it's scary to blindly commit to something that seems like it might upset patients or there might be some operational challenges. So we say, test it out first. We'll be there to help support you every step of the way, work through any, road bumps that come up. But a key part of that is being able to assess success. So did this work or not? And so we need to be able to look at the procurement data to see the amounts of different types of protein, animal and plant-based, that were purchased before and after. Or sometimes we work with serving data, like in hospitals, if you're looking at the number of plant-based or animal-based meals ordered. We also look at patient or diner satisfaction data because, of course, that's also a key metric. No one wants their diners upset. But it is very challenging. Initially we were sending out a spreadsheet and asking the institutions that we work with to categorize the proteins, and it's extremely time intensive. So most of them did not have the staff, they didn't have the time. Also, there were some concerns if they don't have the time or it's not someone who's trained on data, is the data we're getting back really accurate? We didn't have any way to validate that. And so what we started doing initially, basically by hand with a data manager, was coding all this data, which, as Natalie mentioned too, is tremendously time consuming. And so now what we started to do is working with a combination of AI and Python, we have now a prototype of a program that we're hoping to eventually make more robust and then eventually make open source, to take in that raw procurement data and code it and organize it and clean it to look at the types of protein that are being procured before and after. And we have some lofty aims with this, not just to support the individual accounts, but one of the challenges to nonprofits in this space, to funders in this space, is right now there's not even really information available about institutional food service as a whole what is the total opportunity there? If we're trying to make the case to climate funders, for instance, that this is a key area of intervention, right now we don't know exactly how much meat is being procured. And often we see that institutions that do report out plant-based procurement, some of them measure it by just the volume or weight of everything that's not meat. And so they say, oh, we're already 85% plant-based, but they're counting flour and sugar and oil. And so it's hard to compare that to an institution that's actually just reporting out on, tofu and beans. They might only be 15% plant-based. And so getting that apples to apples sense of where does the industry even stand right now? What is the real baseline so that we can set targets for improvement? And we're really excited to be collaborating with a lot of folks in this space it is a gargantuan undertaking, but I think it's one that could help really move this along.
Well, and the theme that keeps coming up is the operational challenges of the complications in any of these institutional organizations, but particularly in hospitals, we set the stage. When we go to breakout, for the hospital breakout, we're going to go even deeper in and bring Jody from Stanford Healthcare to talk about how you get a sustainable food purchasing policy, how you navigate a large organization and make these goals come to reality, because it's not easy, but it takes a lot of partnerships and a lot of tenacity and a lot of data and a lot of beating your head against the wall. And if we have time, I'm going to do a lightning round of questions of some of those barriers. Andrew, I do want to ask you this because I read your white papers and your case studies that you have. When an organization starts actually tracking food waste, because it's not something that traditionally was always tracked. It's becoming more and more, you hear more about food waste in the state of California. There's a lot of focus on that through the SBs and through composting and donation, things like that. If I haven't done any waste tracking at all, and I bring in some type of solution or just even start tracking it myself, what type of results am I gonna see right away?
Yeah, so I think the first thing I would say is you've got to have a KPI to measure. And so one of the ones that we look at is what we call FER, or food efficiency ratio, which is of the food value that has been purchased, what is the value that has been wasted? And so that's a way to sort of look at that economic loss. It's also a way to kind of get around some of the issues around weight that can be highly variable around food waste, just as you talked about it with your example, pasta's purchased dry but thrown away wet. You get all kinds of issues. So you look at FER. Typically, a hospital is going to be anywhere from 2 to 5.5% FER. And so if you imagine that you've got a 5% inefficiency effectively, right? The opportunity is to try to cut that significantly. And we will normally target about a 50% reduction. And that's usually pretty doable. The reason it's doable has a lot to do with the composition of the waste. And so when you look at what's wasted in healthcare, about 65% of pre-consumer food waste is wasted due to overproduction. It means we made more than we needed of a particular item. And that happens for a variety of reasons. We don't want to run out. We have complex clinical diets. There's all sorts of reasons we can go into about why we overproduce. But overproduction is something that is solvable. And so once we know, hey, we've got 65% of our problem is not watermelon rind. 65% of our problem is related to choices we've made about trying to match supply and demand. We can do something about that. So yeah, 50% reduction is typically where we try to focus people. Some operations are going to be inherently a little better, some a little worse, but healthcare as a category has some of the most complex food service operations anywhere, right? I mean, it's not just retail food service, it's not just clinical, it's also in many cases you're running catering operations like a hotel, and you've got in some cases things like behavioral health, or you've got senior living on site or nearby. I mean, there's all daycare, right? There's all kinds of complexity in that environment, so there tends to be a fair amount of opportunity for improvement.
Awesome. Betsy, question for you. You have an initiative that you're working on with hospitals that involves your values-based procurement and food as medicine programs. Super interesting. Would love to hear more about that.
Sure. Well, I mentioned earlier that we do work with hospitals, encouraging them to engage with their communities and collaborate with their communities. And so, with food as medicine, it shows up in different forms. In some cases, hospitals are leading these programs. In other cases, they're partnering with a community-based organization. But either way, we see there's an opportunity for hospitals to carry the work that they're doing inside their walls, outside their walls. Many food as medicine organizations have very, are really rooted in community. That's where they, the large medically tailored meal programs that dominate today, and they began as community-based efforts, and they have very strong ties to local procurement. And we've created a group to test a metrics framework for values-based procurement in food as medicine programs. And the aim is to kind of adapt the anchors and action framework that we're using, put it in a form that food as medicine programs can use so that they can look at their procurement data and understand where they're spending their money and communicate about the impacts of that. So within this group, we have organizations. We have a fruit and vegetable prescription program that's purchasing $750,000 of local product from farms in Western Massachusetts, and they are, they prioritize organic products. We have a program that is purchasing in advance from farmers. It's a meal program, and the director will, make an agreement with a farm to purchase, let's say, $20,000 in local product, and she's taking the product that's available after the farm fills other orders. So there's a food loss component to it. And then we're also working with a hospital that's really interested in expanding medically tailored meals in rural areas, and they've been working with a national program provider, but they realized they could work with a local organization. So they're keeping money in the community, and they're also integrating local products into fruit and vegetable prescription programs. It's in a small New England state where there are lots of small farms that aren't really quite the right size to serve larger institutions, but food as medicine programs can be like the right size fit for those farms. So they can have these programs can have a really big impact, and hospitals can be, strong advocates for making these decisions in these programs so that there are benefits beyond the health outcomes that the programs improve.
Fabulous. And for those of you who maybe have not heard of produce prescriptions, it's basically doctors writing prescriptions for produce rather than medications. And so a lot of hospitals are doing that, and the work that Betsy's doing with some of these hospitals are seeing great results because produce works better than medication a lot of times, right? Quick lightning round, and then we're going to wrap up here. Soledad, what's one concrete step a hospital should take tomorrow if they want to cut food-related emissions?
Focus on menus along with procurement and work with your partners.
Thank you. And Katie, looking ahead, what gives you the most optimism about the future of sustainable food in hospitals?
I mean, we're seeing a ton of interest. Again, New York City, hospitals are literally sending delegations from all over the world to learn about this success. So I think, and also just the win to the triple bottom line, that it's not something that's a sacrifice, but it's good for the business, it's good for patients, it's good for the world. I think everyone is starting to realize that and see this as an exciting solution.
Fabulous. And Betsy, I'd like to ask you that same question. What gives you the most optimism to sustainable food?
Hi, I'm trying to think of a very simple way, but I think just looking at the whole process, I think, when I think about procurement, I'm also thinking about food waste, because I know that that's a loss of funds that can be used to purchase some of these other products. So I think that there's, really being able to take a holistic look at operations is important.
And lastly, Andrew, what's one thing you wouldn't want to repeat again?
Getting chefs locked in a seminar teaching them about Lean and Six Sigma for 5 hours. I learned that's not their joy. Which is to say, data is valuable, but ultimately, how do you take data and get to action is the key part of this.
Right. Thank you. Well, thank you all for joining. I think Christopher's going to end it, but appreciate it. Thank you all.
Thank you.
Betsy, thank you so much.